Well, good afternoon. Thanks for the opportunity of being here for the third time, second as a speaker. And I want to say that this Congress, how do I go? Okay. This event is different. In Brazil, we don't have it with the presence of the patients. I could be able to engage so interesting conversations and learn so much from you and all the colleagues that are really open to share. It is an amazing Congress, an honor to be here. I'm Ana Carolina. I'm a plastic surgeon from Brazil. And for the last 15 years, I've been focused on my work and studies in the sculpture of the upper trunk, upper body, especially arms. As you know, lipedema is not that hair as we used to think. And although the lipedema legs being the focus and the stigma in the lipedema, 80% of the patients who has the diagnosis in lipedema also had in arms. I put a question in the vulva app, and 100% of the women here that answered has lipedema on their arms too. Well, as the knees are the stamp of the lipedema in the legs, I believe that the cubital fat is a stamp of the lipedema in the arms. That fat grows and folds over the cubital area, and it damages and makes difficult to practice exercise, and even because of the hypermobility, it gets injured, and the patient could do it properly, and this is a problem instead of the aesthetic reasons. Well, I bring to you a case, and a case not only to discuss which technique is better, but especially how achieve better results, even aesthetically results. And let's take a minute to observe the numerous types and forms that the arm's lipedema can appear. Not only the advances of stages, but the pattern on distribution of the fat. Arm lipedema is only cited as the fourth type in the current lipedema classification. But since I started to organize all my data, and I realized that it comes in a recognizable pattern, which became an arm classification that I have the honor to bring and presented here last year, and is soon to be published with the help of my dear colleague, Dr. Karen. And this classification ends with three subtypes. We have the upper arm, the whole arm, and the saggy skin type, and with its own staging of developing. Well, once classified, we can be able to suggest surgical procedures or protocols that fits better to each type. Here you can see a stage developing that's maintaining the same pattern of the fat distribution. So I choose to bring to you a typical but yet challenging lipedema case. Challenge since I always focus not only taking off the lipedema tissue, but also deliver beautiful and aesthetically harmonious results, and it is a challenge. Analyzing the patient, we can see an important fatty accumulus mailing in the upper arm, and by measuring the skin elasticity using a simple method, we also observe a high level of loose skin, which fits her in that table, that scale, in the saggy skin type stage 3. So in this case, we will need to work both slim the upper arm, taking the fat, and take care of the remaining skin. Let's point the possible treatments we can use to these arms. The first question is, single surgical step or multiple surgical steps? We can use liposuction only. We can use traditional brachioplasty only, using lipectomy to take the fat. We can perform in a single surgical step liposuction and the brachioplasty to take off the skin, and divide into different steps, 2 procedures, liposuction and brachioplasty. Well, like this is a patient who already had performed in other service a single-time brachioplasty, showing poor aesthetic results. Like these patients, I received many others, already operated but unhappy. Traditionally, cosmetic surgery of the arms, not only lipedema but arms in general, are not one of the most preferred by plastic surgeons due to the unsatisfactory results and those large and visible scars. In my practice, I figured that a single-step brachioplasty in those voluminous arms almost always results in irregular recontour, enlarged scars, and in many times the final result still considered a large, voluminous, flaccid arms and plus with the ugly scar. I've also been able to observe that the result by performing at a unique surgery and unique surgical time, both brachioplasty and liposuction, show limitations that resulted in less satisfactory results, partly due to the concern with the vitality of the skin after high-volume aspiration and the impact of postoperative edema on the scar, generating a higher statistic of dehiscence and scar enlargement. And here, the result after I had the surgeon on her, the second one, showing a much more proportional shape and volume. In my opinion, it's important to say that it might need more than one surgical step, and not just for safety, but due to better aesthetic results. And thinking in multiple steps, I can think, what do first? Well, then I started a protocol, dividing the surgery in two steps, performing first a high-volume liposuction, and then wait for the complete recovery. For only then, in the second procedure, after at least 3 months in minimum, remove just the remaining skin due to better both contour and scar quality. So over the last 15 years, I've been improving this kind of techniques protocol, and especially the arm lipo technique, in order to achieve the highest possible degree of skin retraction so that the amount of remaining skin be as small as possible and for the remaining scars can be reduced. Well, 15 years ago, I've been developed so without using any kind of technology. I designed a technique based on the Langer's line of force that I call Armolipo 360. Well, Langer was an Austrian anatomist, and in 1819, he describes the line schemes of tension, which are well known to all plastic surgeons, and we use it to guide us choosing the better direction in which we draw our scars, so that they are not distorted by the lines of skin tension described by him. He describes it, he discovered it doing many little holes in the skin cadaver, using a tool with a circular shape like an ice pick. And he noticed that instead of the circular tip, the skin had holes in ellipsoidal shapes. From this testing he observed patterns and was able to determine line directions by the longer axis of the ellipsoidal holes and lines. And he drew it like a map. Well, in the arms, the positioning of these lines favors a vigorous centripetal force, a circular retraction, as long as we don't break these lines, which eventually occurs in the traditional brachioplasty due to the perpendicular position of the incision. So, did the move goes? It moves? Oh, it's a movie. Oh, is she hanging the arm, showing all the elasticity that she had? Wow. So what happens when we use the Langer's fundamentals and perform a liposuction and intentionally promote a detachment of the skin from the arm? That's the technique I describe as a lipo 360. Well, followed by the removing and sculpture in the new shape, we witness an important reaccommodation of the skin, followed by a great retraction, explaining by the force involved in Langer's theory. There's no technology, it's physiology. Here we can see 1 week after, and here we can see after 4 months, we can see the skin retraction, and the arms shown even more detail and definition with this technique. Okay, but what will happen in this stage 3 arm lipedema? After the high volume liposuction, how does the skin react? Based on the Langer lines of skin tension and without breaking it with any perpendicular scars, we perform the lipo 360 as described, and we can see the result after 1 week surgery. A skin accommodation happens, it's physiology, and we don't have skin excess. In this position, we can show the volume reduced. I took almost 5 liters from this patient. Here we can appreciate the cubital fat that shows a huge improvement and much more proportional shape. And here, after almost a year, 11 months, this patient came from abroad to Brazil to have a surgery, and she was prepared to have the second procedure, but she didn't come back for the second one because she feels no need anymore. She's happy with the results. I always talk to the patient about the probability of the second surgery, but I let this decision to the patient. And I really see that maybe they do not need the second one, they'd be happy with this one without those long scars. Well, to better measurement of the amount of skin retraction in this technique, I developed a single method that serves both to classify and to compare results, drawing a line from the axillary fold to the elbow, when patient is positioned in 45 degrees, and we measure how much the skin arch deviates from this line. And here, using this measurement method, we can easily see the skin improvement and the difference between. So since we achieve using the lipo 360 technique a reduction of the skin excess, if it's still needed, we can perform a minimal scar brachioplasty, which I have also published with my dear colleague, Dr. Patricia, a minimum scar technique that ends with a minimal scar easy to hide in the axillary fold, and also another different types of mini brachioplasty. And that say I have been delivering aesthetic functional results to my lipedema patients, because I really think that they deserve to be beautiful, and this is not a statement but an idea that a long scar is not the only solution for the big arms. Thank you very much.